Ozzie is a 7-year-old domestic short-hair male-neutered kitty. He came into NorthStar after a 3-day history of not eating very well. His veterinarian had done some blood work and had discovered that his kidney values were elevated, so they were concerned that he was in kidney failure, and his blood sugar was high, which was consistent with something called diabetes mellitus. And so as an internal medicine specialist, he was sent in to see me for evaluation and treatment recommendations. At the time, Ozzie was in a foster home. He's a rescue kitty, and he had had a history of 3 or 4 months of changes to his skin. His hair coat was really thin and kind of scaly, and this was something the owners had noticed but not paid too much attention to, but turned out to be very important in his diagnosis. So we did some initial testing on Ozzie. We found out that he had a urinary tract infection, which was causing his kidney failure. And that was great because we were able to treat him with antibiotics, and his kidney failure has resolved with that treatment. We started him on insulin for his diabetes mellitus, which is the treatment of choice, and he's been doing very well with that. The concern about him was, why did he have diabetes mellitus? And when you see a kitty with fragile skin, we worry a lot about a condition called hyperadrenocorticism, or Cushing's disease. And in this condition, cats have something wrong with their adrenal glands, and it makes them make too much steroid hormone. And in addition to causing the diabetes, it also causes this thinning hair coat and some other systemic signs, and many of the cats, even if we manage the diabetes, pass away from that disease. And so identifying and managing it was very important in this case. I might do a rectal, Jackson. What do you think? I'm almost there. So when cats have Cushing's disease, the treatment of choice historically has been to remove both of the adrenal glands with surgery. This leaves the cats without any adrenal function, which is its own disease called Addison's disease, but we treat them with supplementation and they can live a normal life with that. But that being said, the prognosis with surgery is somewhat guarded, and there's not a ton of information, but about half the cats who have surgery don't survive. The ones who do survive often become not diabetic, and so dealing with his adrenal disease had the potential to both control his diabetes as well as treat his Cushing's disease. But surgery, because of the risks, is not always the option of choice. In addition, people have used medications, so we treat people and dogs with Cushing's disease with medicine, but they're expensive and not as effective in kitties. And so for Ozzie's case, we discussed with Dr. Stobie, who's one of our surgeons and the practice owner, a novel approach to this case, which was to use something called cryoablation to treat his adrenal glands. Cryoablation has become more and more popular in human medicine because not only is it less invasive, but it can sometimes be done with a laparoscope. It can be done without an open surgical procedure. There are very limited reports of using this technique in dogs and cats. There's at least one study that showed it was safe to use in dogs with adrenal disease, but not a lot of cases that have been reported clinically. Since his adrenal glands were so large, and we knew that they'd be difficult to remove because they sit near some very large blood vessels, the option to do cryotherapy was selected. So about 2 weeks after his diagnosis, Ozzie was taken into surgery. The left adrenal gland, which was really big, was removed because we thought it was too big to do this procedure. But the right adrenal gland was treated with 8 rounds of cryotherapy, which they felt was enough to cause the entire gland to be treated. And then he was recovered, and he remained in the hospital for a couple of days. In a couple of days after surgery, he had a period where he developed a little bit of abdominal pain and fluid, but this is what's reported in people, and it resolved on its own. We added in some antibiotics to be safe. And about a week after treatment, he went home, doing really, really well.
You don't feed him, no.
Here. When Ozzie left the hospital, his kidney values were normal, which was great, but he was still diabetic, and this was to be expected because it takes about 4 to 6 weeks for the full effect of the cryotherapy to be known. When we followed him up at 2 weeks, he was doing great at home. His skin changes, amazingly, in 2 weeks had changed dramatically. I couldn't believe how rapid the improvement was with the removal of the adrenal glands and the treatment of the right adrenal gland. And his diabetes was well controlled. And he actually just came in to see us a couple of days ago for his 4-week follow-up. And at this point, when we checked his blood work, he appears to no longer be diabetic. And so we feel like the combination of removing this adrenal gland and treating the other one has resolved his Cushing's disease, as well as resolved his diabetes, which is what we were hoping for. Unfortunately, the biopsy of the left adrenal gland that we removed did come back as a type of adrenal cancer. And since it's been removed completely, the prognosis could still be quite good here. And we don't know for sure whether the right was cancerous or not, but we are going to keep an eye on it, and we have the option of retreating him if that seems like the right thing to do. But for now, Ozzie's back in his foster home with the children and with his kitty friends and doing great and no longer requiring insulin. So this is a really happy outcome for us.
Yeah, I'm a volunteer with Save Animal Rescue out of Toms River. I'm Ozzie's foster, and I've had him since probably about the beginning of December. I took him back in after his surgery. Ozzie is a wonderful pet. He is doing great. We took him in as our foster, knowing that he had the medical problems and understanding that it could be for possibly only 2 weeks or 2 months. But he's doing great, and I think he's going to be around for a while. So he's very comfortable at our house, and I think he's going to be a permanent foster for us.
Ozzers. You know, a lot of what we do is fairly routine, and we're really good at it, and you know, and we do make patients better, but it's the opportunity to sometimes take something into a different place, to do something new, to improve the outcome, you know, and to give this cat in particular, who had been living on the street. If he had been on the street and not in his foster home, you know, he would have had a horrible life and probably a horrible death. But to be able to not just fix him, but to sort of expand the use of a technique in veterinary medicine in such a successful way is amazing. And it's one of the great things about working at NorthStar.
Look at his tongue. So cool. He's so cool. Ooh, yummy yums. Oh my God.
Like,